This year's conference, as we have done and tried to do every year, I think is exciting because we can attend in person, and that will be great. But the topics in terms of the discussions are really these practice changing results with new antibody drug conjugates in HER2 positive triple negative breast cancer, understanding new definitions of subsets of breast cancer, for example, HER2 low, talking about new endocrine therapies and what we're looking for in the next year and 2 years in terms of these new endocrine therapies. How do we sequence the treatments? Who should we apply some of these new targeted agents, CDK4/6 inhibitors being, I think, the biggest question in early stage disease, and who are candidates for treatment in the neoadjuvant setting with either chemotherapy or endocrine therapy. And then I think we all find it, confusing about the gene expression panels and how we apply those now, given the recent data from the RxPonder trial. So hearing the perspective of the authors of the RxPonder trial, Kevin Kalinske, and the discussion between different key opinion leaders on this field, I think will be really helpful in terms of how to bring this back to the clinical practice, but just how to interpret that data and what the next studies we need are to try and better refine the use of gene expression panels. Of course, in looking at the novel therapies, immunotherapy has made a huge splash this year, where we've seen an improvement in event-free survival with checkpoint inhibitor in the early stage setting for triple negative breast cancer, and an improvement in overall survival in patients with PD-L1 positive disease in the metastatic setting, adding to our armamentarium in treating the most difficult subset of breast cancer, both in early and late stage disease. And we'll talk about both the application of immunotherapy in triple negative breast cancer, as well as next steps and markers, how to interpret the markers in clinical practice.